Thanks for joining us, and we're going to do a couple stretches to help the health of our wrists. So both stretches are going to be in the standing position. The first one, we're going to use a wall. Just check in and move your wrists around and see how they feel now, and then we'll check in after we do these exercises. So the first stretch is for the skin muscle group, which runs along the back of the arm and the back of the shoulder blade, and it helps regulate movement at the wrist. So you want to stand perpendicular to the wall, and so we're going to stretch the back of our left arm and shoulder. So this part of your arm is going to press against the wall. A little lower than your shoulder, okay, it's going to press in. You want to hold on to your wrist here for stability and help. And then you want to get your legs kind of bent in a nice, comfortable, athletic position, and press your elbow straight into the wall, right? And you can feel the back of your shoulder engage. Continue to press against the wall as you sit back to stretch the back of your shoulder with resistance, and let it go and come back to the start. Resist, press that elbow in. My right foot is out wide for stability, a little wider than my shoulder. Resist, press in, press in, press in as you sit back, and then relax as you come forward. Reposition your feet as needed. Resist, we're driving that elbow into the wall, the back of that arm, and then let it go. So you're resisting continuously. You want to keep the ribs in, tailbone tucked. Breathing in and out through our nose. Let it go. Let's just do a couple more here. Resist and let it go. Resist right in the start. Drive the elbow back before you start to move. Let it go. Okay. All right. Shake that out a little bit. If you shake your wrist, it feels nice in the shoulder. The wrist is a little looser. Can you feel that compared to the other arm? So let's do the right, okay? Stand perpendicular to the wall, elbows going into the wall. Actually, the back of the arm. It's a little lower than your shoulder, as low as comfortable for you. Grab the wrist, press the arm into the wall as you sit back, and relax coming forward. And you reposition yourself after every few repetitions or so. Let it go. Resist, resist. So the muscles we're stretching on the back of the shoulder and the arm, you want to start in the shortest possible position. So I'm noticing on this side, my chest wants to open a little bit, and that shortens the back. And then you start to resist from that short position, and then as you turn your body with the resistance, it's lengthening, and then let it go. Resist, resist. I'm also noticing that this arm is a little lower than the other side. They're different, two different sides. You might feel a difference between your two sides. Resist, keep those ribs in, tailbone tucked. Let it go. Very tough tissue, a lot of force on the back of our shoulders. Resist, resist, and let it go. It's also a great stretch for the health of your skin and lymphatic flow in the body and drainage. Resist, resist. Let's do about two more. Let it go. Okay. Feeling better in the wrists, feeling better in the shoulders, a little more open chest because the back can shorten. Now we're going to do a stretch for the chest and biceps. It's the pericardium. It'll improve the health of your pericardium as well. So let's interlock our hands behind our back. And we want to bring our shoulders forward, right? We're stretching here, so it'll end up back here, but we want to start with the shoulders forward. Bend your elbows. And again, I like to bend my knees a little bit, tuck the tailbone. So close the shoulders or bring those shoulders forward. Now the resistance here is pulling your hands apart. Pull your hands apart, and then you lift and continue resisting and lifting, and then bend forward at the waist, and then relax the tension in your hands and come back to the start. So let's do about a half a dozen. Resist, resist, continuously resisting. Keep those ribs in. Let it go. Bring the shoulders forward at the start. Resist, resist. Elbows bent. Can feel it in the front of the chest and in the biceps, and then relax on the way back. Breathing in and out through your nose. Resist. Resist. This is getting into the bicep and the pec minor mainly, but other parts of the chest too. Resist. Resist. Let it go. Remember, we want to improve the health of our wrists, and these are 2 good stretches that really help with that. Let's do about 2 more. Let it go. Close those shoulders. Let it go. Starting to feel a really nice little burn in those muscles in the biceps and in the chest. And let it go. Okay. Whew. Shake it out. Wrists feel really good. Open up in the chest.
Hey, John, can you, because, so the 2 stretches that you just showed folks are associated with muscles like up around the shoulder,
Right.
and in the triceps and biceps. And so can you just talk about how, when there's an issue, like a symptom of pain down in the wrists, how those, higher joints, elbows and shoulders are involved and how it's connected?
Well, yes. One way is through the fascia tissue in our body, the connective tissue. It's a fascial plane. And there's electrical currents that are housed in the fascial plane. So for the skin, it runs down the back of the arm and down into the back of the middle finger.
Both the fascial plane and the meridian, the
fascial plane and the meridian, yeah. So you change what we're saying is the cause. This is the symptom, ouch, in there, and the source. So you want to change the toughest tissue in the body so that the meridian is freed up, and then the fascial plane and all the muscles involved in that plane as well.
Well, and also, isn't it true, that like an issue can happen in one joint, but there's like a ricochet down, up and down into the other joint. So it's usually not a problem in isolation.
It's not. And the symptom, now you can go after the symptom and help that, but the source will always be there.
Yeah.
If you change the toughest tissue, and it is a chain reaction, and it affects either going down or up,
right,
and then the lower leg.
Because we compensate, like if we have an issue in one area, we're going to start holding our arm or our leg in a certain position, and that's naturally going to affect all the joints in the arm and all the joints in the leg.
Oh, sure it will. Yeah, sure it will. And again, changing the fascia where it's the most dense, and where it's most dense is not necessarily where we have pain or symptoms.
Right. And so how many of these stretches would you recommend that someone do to impact their wrists?
Do 3 sets. And start between 6 and 10 reps, but you can increase that as your aerobic capacity increases, and you'll be able to do more, and you'll have a result immediately, but then there's a cumulative effect of changing the fascia as well.
And should they go back and forth between the skin stretch and the pericardium stretch?
That's a great idea. Do skin, pericardium, and do it that way.
Cool. Anything else?
Also go to our hands video.
Yeah, there's a blog on hands, and so if you have problems in your wrist, good chance you have symptoms in your hands as well, and so there's some stretches in there you might want to add to your repertoire.
Yeah, they work nicely together.
Cool.
Good luck. Let us know how you do.